Most welcome to this very important annual meeting for the International Association of National Public Health Institutes. So my name is Claude Muvunyi. I'm the Director General of the Rwanda Biomedical Center, which is honored to host this annual meeting with IANPHI together. So first of all, I think Kigali, Rwanda is really honored to host this very important annual meeting of IANPHI. And I think without taking much of our time, we do have a very tight and really good sessions to cover for two days of the meeting. I think we are very happy, dear colleagues, directors of national public health institutes from different countries, delegates from different regional and international organizations that are assumed they're here: WHO, Africa CDC, UNICEF, UNAIDS, and also other public health agencies from different countries, from Africa, Europe, North America, America, and so on. So again, I think it's really an honor to welcome you all to Rwanda and really discussing on how we as public health leaders, we see the current public health status, but really discussing on how to advance the public health and also building resilience and also sustainability of what we are doing. So again, we have the honor of being with the Minister of Health of Rwanda, who is going to join us in a few minutes. So when he comes, please show him most welcome, as he's really has accepted to be with us despite his busy schedules. So for today, maybe I will tell the team to tell the protocol that we are ready to receive the ministers. Thank you very much again for you being here. So maybe before we get to receive the ministers, I want to probably to tell you a little bit about the Rwanda Biomedical Center. Rwanda Biomedical Center is the main implementing agency of the Ministry of Health, which is the equivalent of the National Public Health Institutes of other countries. This Rwanda Biomedical Center was established in 2011 through a merging of different programs which were working in the vertical ways under the Ministry of Health. Those programs were TB program, malaria program, HIV programs, epidemiological program, mental health, and also maternal and child programs. So all the programs came together to really form this Rwanda Biomedical Center. So we have been existing since 2011. So we have today around 13 years of experience. We have really been able to build different structures and organizations to make sure that we have new programs to really cope and meet the current expectations. So as of today, so thank you very much. So welcome the Minister of Health, Dr. Sabin Sanzimana, who is going to be with us for today. Thank you very much. Thank you very much to all of you. Honorable Minister of Health of Rwanda, and dear Prof. Dukan, the President of IANPHI, the representative of WHO Rwanda, Dr. Brian, all protocols observed, directors of National Public Health Institute. As I was saying at the beginning of these sessions, it is an honor for Rwanda, Kigali, but also the Rwanda Biomedical Center and the Ministry of Health for Rwanda to be the host of this annual IANPHI meeting. So without taking much of the time, I would like to take you through the first session agenda, which I think is going to be really very important to go through some of the high-level guidance and orientation for these meetings, which is going to be given by Prof. First of all, we'll hear Prof. Dukan Selby, who is the president of IANPHI, and also the founding executive secretary of the UK Public Health Agencies, but also advisor to the Saudi Public Health Authority. And then we'll also hear topic from, Brian Chirombo from WHO, who is going to provide us a keynote speak on how IANPHI public health institutes are partnering with WHO at the country level, regional level, but also global level. And it's going to be followed by Dr. Taj, who is here on behalf of the director of Africa CDC, who is also going to provide some keynotes on some of the rapid development on the continent and at the Africa CDC highlights on this 2023 conference on public health in Africa, as we know that Africa CDC is very key in bringing together all those national public health institutes. And last but not least, we have the honor to receive the opening remarks of the Minister of Health, who is going to really open this session for us and also declare this meeting open and also other sessions to follow. So without further ado, I'd like to invite Prof. Dukan to also provide his key remarks. Thank you.
Thank you, Claude. Thank you, Claude. Welcome, Dr. Sabine. It cannot be sufficiently said what a pleasure it is, an honor to be here in Rwanda. It's a beautiful country. I have been to many parts of Africa. I haven't been to Rwanda before. This is just the first time. And to spend time together here is the most precious use of our time. We meet, we speak, we do a lot by video, we exchange and we share, but we learn most of all by being together, and being together over these next 2 to 3 days is the real point and purpose of us being here. Prof. Claude said thank you to many, and I'm always afraid that I'm going to miss, and I do saying thank you to Rwanda, the team that have made it possible for us to be here, the IANPHI team led by Philippine, Tom, Paul and Jessica, working together. The country office, we're going to hear from Dr. Brian of the WHO, the hub in Berlin, and our colleagues in Geneva, without whom this would not have been possible again. We are only as strong as each other. Our whole point and purpose, our mission, is to strengthen public health infrastructure, public health services, the implementation or the deployment of against the essential public health functions. We're going to hear a lot about great work that's been done by IANPHI led by the WHO on the operationalising the practical application of the essential public health functions. Now, we are the international gathering, the world's gathering of national public health institutes, but actually what we're concerned about are the essential public health functions and public health services. And those countries that have a national public health institute, where we can work together to strengthen what they're able to do and their impact. Where countries don't yet have such an institute, our concern is not that they start with an institute, but that we start with where they are in their context and what would help them the most. And IANPHI exists to be there for everyone in the world. We are known as the gathering of national institutes, but our concern is the deployment, application and implementation of the essential public health functions for the betterment of health and well-being around the world. With my thanks particularly to Prof. Claude and the Rwanda team here, I want to pass over to Dr. Brian from the country office here in Rwanda to follow with his remarks. Thank you.
My brother, Dr. Sabin Nsanzimana, Honorable Minister of Health of Rwanda, Professor Selby, President of IANPHI, Dr. Tajuddin, representing the DG of Africa CDC, representatives of the Public Health Institutes, representatives of partner institutions, colleagues from WHO at the 3 levels, ladies and gentlemen, good morning. It is my pleasure to add a welcome to you to Rwanda, the land of 1,000 hills. On behalf of WHO, I would like to thank the government of Rwanda through the Ministry of Health and the Rwanda Biomedical Center for hosting this very important annual meeting of the International Association of National Public Health Institutes. I would also like to thank the IANPHI Secretariat for inviting WHO to this meeting. Special thanks, of course, go to all the participants, those who have joined by traveling from all over the world to participate in this annual meeting, and those who are also joining us virtually. All of you bring your valuable expertise and experience, and it is you who make this important meeting. This meeting really comes at a very crucial time, as we know, when health systems are struggling to meet a wide range of health population needs in a world that is changing. Climate, population, demographics which are changing. And populations remain vulnerable to the complex public health challenges that we're facing in this changing world. The COVID-19 pandemic clearly demonstrated that strong public health capacities are needed to build resilience and support the achievement of universal health coverage and health security. It's not just about health security, but about the whole health of our communities. This also presents an opportunity to advance public health, drawing on the political commitment that we have seen, the resources that have been mobilized, and the lessons that we have learned to strengthen health security. And it's really critical for us at this time because we know the excitement that we had as a result of the pandemic is beginning to wane. So we have to seize this opportunity. Despite this, public health remains under-recognized, under-resourced, and underutilized globally. I'm pleased to report that WHO and IANPHI have been working together in partnership to begin to reverse the situation. And we have signed a landmark memorandum of understanding, that happened in October 2023. We already had been working together before, but this gives us a framework for us to even work closer together. And the importance of this partnership was highlighted by my Director General, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, in a message that he sent to this conference. And I quote, "To achieve universal health coverage and health security around the world, we must coordinate our efforts to support all countries in building the public health capacities needed to protect and promote health and achieve equitable access to services." The work of IANPHI and its member institutions and the impactful partnerships they forge supports our shared ambition of sustainable and resilient health systems that can deliver health for all. End of quote. Though this partnership between IANPHI and WHO, or through this partnership, we have developed as one of the key products guidance to support countries in strengthening public health functions and services at global, regional, and country levels, whilst we advocate for greater equity, inclusiveness, and coherence. This guidance, which is actually just hot off the press, as it was published this week, can be used to advocate for a broader approach to public health that embeds in it preventive, protective, and promotive capacities across the system. And it can be used to strengthen the role of national public health institutes. The essential public health functions that we will be talking about in this conference ensure that we put in place a comprehensive and integrated approach to strengthening public health in our countries. And benefits include ensuring that we orient health systems to the real needs of the population. We strengthen prevention and promotion within the health sector. We promote the multi-sectoral approach to health. And finally, we bridge universal health coverage and health security efforts. With the theme of advancing public health and resilience, and of course, with our contributions here, I'm happy to report that we also have a critical side meeting that is organized by our Berlin hub, the WHO Berlin hub. And we'll be able to, through that, strengthen collaborative surveillance, consider the new tools and mechanisms, such as strengthened international pathogen surveillance and data analytics for public health through the WHO Berlin hub. This will help to assist us to move forward and strengthen our moving forward on the institutional capacities for essential public health functions in support of orienting health systems towards primary health care for universal health coverage and health security. We know that primary health care is the best way of reaching universal health coverage and of ensuring health security. And I can just digress for a minute that Rwanda is one of the example countries that showed that if you have a strong primary health care system, your response, even to health security and emergencies, is better. We as WHO, one of the things that we did was to look at essential health functions in countries during the pandemic and see whether countries were ensuring that essential health functions are still delivered. And Rwanda was one of the countries that showed that it had very little disruption. And we know that most of it was explained by the very strong primary health care system in this country. I note that during the conference, you will have time to discuss, share experiences, and come up with better ways for public health institutions to play their role in supporting member states strengthening national responses. I would like to finally reaffirm the commitment of WHO to work in partnership with IANPHI, in partnership with Africa CDC, in partnership with other institutions, and of course, in partnership with the national public health institutions that we work with and support, so that we can support countries in their efforts to build resilient, sustainable health systems for better health and well-being towards universal health coverage and health security. I wish you successful deliberations in the next 2 years, in the next 2 days. We could make it 2 years, but for now, let's bring it back to 2 days and look forward to concrete, actionable recommendations that will help us to move forward the public health agenda, and particularly ensuring that we strengthen the national public health institutes. So finally, I would like to encourage you to take some time. I know that the 2 days are packed, but I would like to recommend that we try and create a bit of time to see a bit of the beautiful city of Kigali. And if you can manage, I would strongly recommend that you also visit the country. It's a wonderful country that you really enjoy. So colleagues, ladies and gentlemen, I thank you.
Your Excellency, Dr. Sabine Nsanzimana, the Minister of Health of Rwanda, Professor Duncan Selby, the President IANPHI, WHO Country Rep, Director Generals of MPHI globally, Head of Delegations, distinguished colleagues, ladies and gentlemen. I bring you greetings from Dr. Jean Kaseya, who would have actually loved to be here, but as I'm talking to you now, is receiving the president of Comoros, who is the chair of AU, and is also the chair of the Committee of Head of State and Government in charge of the Africa Centers for Disease Control and Prevention. So let me start by saying that as Africa CDC, we're actually proud to be part of this annual conference. And I would like to thank the government and people of Rwanda for hosting this IANPHI conference. The theme of this conference, Advancing Public Health, Resilience, and Sustainability, is indeed in alignment with Africa CDC strategic priorities. If you have taken time to visit our website, you will see that the Africa CDC next 5-year strategic plan emphasized, one, the need to strengthen integrated health system to prevent and control eye-burden diseases. Two, to build proactive surveillance, intelligence gathering, and early warning systems. Three, ensure robust emergency preparedness and response capability for all public health emergencies. Four, strengthen national public health institutes, which is key to what we'll be doing here for the next 2 days. In fact, the DG of Africa CDC want to see Africa CDC replicated in each and every 55 member state of ours through establishment and strength of MPHIs in all the AU member states. 5, expand clinical and public health lab systems and networks. 6 is to expand health product and technology innovation and manufacturing. Colleagues, ladies and gentlemen, Africa CDC has collaborated with IANPHI since we came on board 7 years ago. We celebrated our 7 years just some few days ago. We've worked together to strengthen the capacity and capability of MPHIs to maximize the use of surveillance data to inform public health decisions. The IANPHI annual conference continues to provide opportunity for our member states to discuss science and serve as a platform for exchange of ideas and experience sharing. We have worked with some of you to establish and strengthen National Public Health Institute in Africa. The record is there for all of us to see. Our engagement with IANPHI is moving from a mere letter of intent that was signed when we came on board to a robust, comprehensive cooperative agreement, that's memorandum of cooperation, and we are almost finalizing that. And the goal of this partnership, again, is to ensure that each and every AU member state have a functional National Public Health Institute that can deliver on the essential public health functions. Your Excellencies, ladies and gentlemen, the AU Head of State and Government in 2022 called for a new public health order that is underpinned by strengthening of public health institutions, again, laying the emphasis of the strong political support for the MPHI agenda on the continent of Africa. The head of states have also called for strengthening of health workforce on the continent, including community health workers, expand local manufacturing capacity for health security commodities, including vaccines, diagnostics, and therapeutics, domestic resource mobilization, and respected action-oriented partnerships, which I believe these next 2 days is going to provide that opportunity to continue to form that strong network which MPHI agenda actually truly stands for. This is the only way we can guarantee the security, sovereignty of our member states. So as Africa CDC, what has been some of our key highlights for the past 7 years? Let me state that the discussion around the establishment of Africa CDC started in 2013 in Abuja, Nigeria. And that proposal was put forward by no other person than DG Tedros Adhanom, when, as a chair of the Ministers of Foreign Affairs of the continent of Africa at that time, called for the need for Africa to have its own public health agency. Fast forward, Ebola struck, and this really fast-tracked the establishment of Africa CDC. In 2016, our head of state and government gave their seal of approval for the governance statute of Africa CDC. In 2017, we were established as a specialized technical agency of the intergovernmental political institution called the African Union. In 2018, we developed the first instrument as Africa CDC, which is the National Public Health Institute framework, again underscoring the importance that Africa CDC attaches to MPHI agenda. In the same way, we also launched event-based surveillance framework in that 2018. In 2019, in order to ensure access to diagnostics by our member states, we launched the African Collaborative Initiative to advance diagnostics. In 2020, the COVID-19 struck precisely on February 14 in Egypt, Cairo. A week after that, through the political leadership, of African Union, we were able to come up with a joint continental strategy for COVID-19. And in the same vein, we established a task force to drive that strategy. And the record is there for all of us to see. If not for anything, I think the response to that COVID-19 that was led by Africa CDC underscore the importance of regional mechanism when it comes to global health governance. In 2020, we also established some couple of our tools for the COVID-19 pandemic and, for the COVID-19 response and beyond. This included the African Medical Supply Platform that allow our member states to have equitable access to all those life-saving tools and medical supplies. In the same vein, we also launched the Partnership for Africa Vaccine Manufacturing, which also will allow us to shift the needle from the currently 1% of our vaccine need that's being produced on the continent to 60% come year 2040. In 2021, we launched the first conference of public health in Africa virtually. And in 2022, again, Rwanda was very gracious enough to host us for the second annual conference on public health in Africa. And that was an in-person sort of meeting. And that was a very huge success. Again, thanks to the people and government of Rwanda. 2023, we had the second conference of public health in Africa. Allow me to unpack some of what transpired at that conference in Lusaka. So that conference provided an opportunity to share best practices, highlight lessons learned, and showcase existing homegrown capacity to accelerate progress as far as addressing numerous health challenges facing our continent. Let me also say that in 2023 alone, the continent recorded 166 major disease outbreaks, which underscored the need for a platform to discuss lessons learned, share best practices, and collectively agree on how best to move forward, in terms of putting together a resilient and sustainable health system. And at that particular meeting, we had over 5,000 scientists, policymakers, decision makers, political leaders, and advocates in attendance in Lusaka. The agenda for that CPHIA, or Conference of Public Health in Africa, followed the pillars of our new public health order. So the tracks that were covered included health security, pandemic preparedness, universal health coverage, just to re-echo my colleague from WHO. So particular emphasis was given to boosting local manufacturing of medical products, because our head of state and government have put before us an ambitious agenda to ensure that a continent of 1.4 billion people, 55 member states, cannot and should not continue to import what I describe as security commodities. So it's a must that we should move that needle from the current 1% to 60% of our vaccine needs by the year 2040. Local manufacturing, according to Jenkasai, DG Africa CDC, is the second independence of Africa, because it will mitigate our reliance on external sources, it will build our air security, it will promote local innovation, it will lead to job creation, and also economic growth, and lead to peace and security. This is according to Jenkasai. The last Conference of Public Health in Africa also called for greater investment in health workforce. As we all know, only a few member states actually have what I describe as a robust health workforce to respond to any major outbreak on the continent of Africa. And in this regard, our head of state and government have put in place health workforce tax team under the leadership of President Cyril Ramaphosa of South Africa to come up with an investment plan, and they are ready to push it so that it gets the necessary political backup. Again, as Africa CDC, we continue to support the community health workers agenda, because as my colleague from WHO did mention, we need to strengthen the primary health care, because they are at the forefront when it comes to any disease outbreak. Colleagues, ladies and gentlemen, that meeting, the CPHIA in Lusaka, emphasized the importance of leadership, collaboration between sectors and partners, and real-time data sharing and community engagement. Let me quote here: leadership and science alone cannot solve community problems. Rather, we need strategic engagement of the community. So this statement is credited to no other person than Dr. Sabine Nsanzimana, the Minister of Health of Rwanda. Our head of state and government at that same meeting did really advise us that we need to move from discussion to concrete implementation. You know, this statement was echoed by the president of Zambia. Your Excellencies, ladies and gentlemen, to conclude, I leave you with this quote from my boss, Dr. Jan Kasaya. We have to harness technology. We have to embrace equity and social justice. We have to foster robust collaboration that cut across borders and discipline. It demands a concerted effort to amplify the voices of the most vulnerable among us. Together, we can break, and we will break the barriers that have hindered our progress for far too long. And we can forge a new public health order for Africa, a public health order that is resilient, equitable, and capable of meeting the challenges of the future. Dr. Jan Kasai. I thank you all, and please do remember to visit Rwanda.
Good morning. Bonjour. Some French speakers in the room. Very happy to be here today to join this great meeting. Professor Duncan Selby, we've met many times online. I don't know if you remember, even in the middle of COVID-19, when I was head of Rwanda Biomedical Center and active member of IANPHI. When I heard that you're coming here, I said, welcome, this is your home. Dr. Raj Taji and Africa CDC team, thank you so much for being part of these important discussions. WHO, Dr. Brian, and the entire WHO team and the UN family in general. Very happy to have you, and also for your commitment to continue work with all of us as a team, because the health of all of us. A few weeks ago, I was in Geneva with colleagues, including Dr. Tedros, for the WHO Executive Board, which Rwanda co-chairs. So we're very happy to go through a number of strategies and documents, including what we are discussing here today, and align towards the same goal. To all leaders, friends, ladies and gentlemen who joined, welcome once again to Rwanda, to Kigali in particular. Feel at home and stay as long as you wish. For the 2 years you mentioned, it was not a mistake. It was that is how we welcome people to Rwanda, so you can stay for more years as you want. First of all, I want to say congratulations to all of you, members of IANPHI, for successful response to COVID-19 in the last few years. You can clap for yourselves. Well done. That was a challenging moment, 2-3 years. It's not yet over, but at least we navigated through the difficult part. And here we are, looking at what we achieved together, what we didn't manage well, and what we can do even better, because we have better tools, better lessons, commitment, network, friendships, and even the science has evolved significantly. So let's take this opportunity to be ready, because outbreaks and pandemics never rest. I think they're also having their own conferences. trying to outsmart ourselves and see how they can make our health systems weak and even take our lives. So we must work much harder, much smarter, much collaborative and united, so that when another virus decided to put us down, flights grounded, scientists staying home, even doctors hardly reach hospitals. We should not accept that to happen again. But that should not be just a statement. It should be actions. There are things we must do differently so that we don't say, oh, another pandemic, another outbreak has just happened and we are not ready. So we see many good examples of what we can do better. I was reading the news just 2 days ago in Zambia and other southern part of Africa, how they managed so quickly the cholera outbreak. And this is yet another example of how we can detect, respond quickly, and get back to work. So congratulations. I don't know if there's anyone from Zambia or other neighboring countries that we should acknowledge for what you did so recently. It's not just this. There are many other outbreaks. There are many other pandemics that are happening, contained. You should continue this way. But how? How can we even do better? I think the answer is in the theme of this meeting. We must be more resilient. We must build sustainable infrastructure, equipment, but more importantly, the people to train who are capable to manage the whole cycle of preparedness, detection, response, management, communication, and engagement of the community, as has been mentioned before. I want to highlight the importance of research and diagnostics, because during COVID, this is an area we suffered the most. We've been trying to call each other. Can you help me on this? Can you help me on this? I think we made so many phone calls for those who are managing national public health institutes in your countries. You know how we needed each other in that time. And I think everyone you called or who called you, you wish you could have helped more or could have helped you more, but we were all almost on the same level of challenges with test kits, with PPEs, later on with vaccines. So we're all struggling differently. But later on, we also saw how our health and pandemic response is so fragile, but multi-sectoral and connected with other aspects of politics and geopolitics and regional, I would say, protectionism of what I have, weight, and what I can share could come later on. So that, again, is another lesson of equity and how we should see ourselves as one community, one family. We should not forget that element, especially as we have this meeting here on this continent most affected by this pandemic, but also for other health problems, which are mostly in this part of the world. So that is an important lesson to think about. So imagine if today another pandemic like COVID-19 starts. What can we do differently? What can we do that could be better than what we handled last time? Are we going to share more knowledge, share more resources, share more PPEs and vaccines Are we going to send experts to each other to help each other? Or is still something about my institute or my region or my team? This is another question we should be reflecting on during this 2 days meeting. What have we done before or after the active phase of the pandemic that has improved, even with what happened in southern part of Africa? But recently, how many teams have we sent to help with cholera outbreak containment? How are we helping other colleagues in other parts of the world who are suffering from this? So these are questions I ask myself that you probably ask yourselves from just statements, commitments, and speeches. What has really, really changed from that aspect? To the laboratories, have we built more capacity? Can we do sequencing everywhere? Can we detect variants everywhere? To the treatment, do we have enough treatment centers for any disease? Do we have isolation centers, at least in our regions, in our countries, that can help to minimize the infections and transmissions? So these are, I'm trying to give you a kind of homework as you go into deeper discussions. I may not have the answer, but I believe these are helpful. In terms of innovation and partnership, I want to highlight some good examples. Not that we failed on many things. We've made progress on other good things. And I want to cite a few examples. In December, here in Rwanda, we launched the BioNTech mRNA vaccine factory or plant in partnership with BioNTech from Germany, some people from Germany here, and Africa CDC, WHO, different heads of states and agencies come here. So this, again, is an example of some steps that we are making that we should continue. And it's not only in Rwanda, I know in Senegal, South Africa, and other hubs are looking at the same very soon. And we have other examples. But these factories, this manufacturing, these are more of research centers, training areas, but also partnership points of contacts that we should build and sustain for future threats and outbreaks. We're not going to manufacture COVID vaccines in this factory here right now because maybe the need is not as the same as it was 2 years ago. But we are looking at, what about cancer? What about NCDs? What about other vaccines that we don't have in good quantity, even the efficacy of those that we already had for the past? And we're building an ecosystem of manufacturing here in Rwanda. We have actually Kigali Health City that we established recently that hosts a few facilities, including highly Center of Excellence for highly infectious disease, a center for isolation that we are building in support, in partnership with Robert Koch Institute and the government of Germany. The same Kigali Health City are building also laboratories for Rwanda Food and Drug Authority and Rwanda Biomedical Centers, and beside other hospitals that are in the same area. I wish that if you have time, I could visit that beautiful area. We also launched a center for digestive cancer surgery that includes robotics and artificial intelligence technology for applied to surgery that we're building, that we built. Actually, we launched it last year with the Professor Maresco from France, anyone from France, in other partnerships. So this center is already training surgeons from across Africa, and we believe that centers like this across the continent will be helpful and even beyond. There are many other examples, but these are few compared to what we can achieve all together. I don't want to conclude without saying that much as we build manufacturing centers in tertiary level care, we must also strengthen our primary health care as much as possible. We need our community health workers to be equipped with tools, with trainings and information to detect and report any signal or any early warning information that could become an outbreak or a pandemic. We must train them with tools to make sure they detect non-communicable diseases before they become too late at tertiary level. We must build referral and reporting systems so information and data are well captured, analyzed, understood, and decisions are made. With this, I would like to thank you all for having chosen to come to Kigali. I thank RBC, Professor Claude Muvunyi, for having been a point of contact with the team of RBC and our colleagues, partners, who helped to organize this meeting. And I can't wait to see the report of the actions at the end of this meeting and see how we can start implementations, because actions, decisions can remain there. If they are not executed, as you rightly said, they remain dreams and wishes. So we must go back and change and evaluate on ourselves on the impact we've made in our communities. Don't forget to visit Kigali and see how our communities, the ecosystem, how the One Health works beyond the meeting rooms. Have a great day, and I declare the meeting officially opened. Thank you.
So thank you very much, Honorable Minister. I think we can just give another round of applause to the speakers who have really thrown out some good hope, questions, requests, which I think this meeting is going to try to discuss on, address, and really come up with good resolutions. As I can say, how do we translate those discussions into concrete actions and also next step. So this is the end of this first session. So we're going to continue with other sessions, which is going to really going around how do we strengthen public health institutes and the workforce. How do we use digital technology and artificial intelligence in our interventions? How do we understand the impact of climate change on public health? And how are we ready in our system to be able to respond to those impacts? And also, how do we collaborate to build those sustainable surveillance and response system? As the Minister of Health said, the pandemic is still there, but in addition to pandemic, we also have other priorities like non-communicable diseases. And last but not least, we'll be able to leave this meeting with some kind of Kigali declarations, which I think could be something very, a document, which I think as the directors of public institutes, we'll be having it in our hands. We'll translate it into our workforce, our people, but also reporting in our next annual meetings. So again, thank you very much for being engaged in these sessions. So we conclude this session by a round of a session of photo, group photo. So the group photo is going to happen the first floor, and the protocol team will be there to guide you to the place where we are going to have a group photo. And then, as all the speakers alluded to, please take the time, in addition to the tight programs, to visit Kigali. And my team, the team here at Protocol, will be able to support you, to assist you in those nice places to visit. So for the meetings, I think for the next sections, we are going to have an hybrid session. So there's online support for those who were not able to join us. We'll be also able to share some PowerPoints from the discussion, but also the records of these meetings. So again, thank you very much, and I wish you 2 days rich of discussions, but also some fruitful discussion resolutions. So without taking much of a time, if you allow, we move to proceed to the group photo. And that's all. Thank you very much for this session.